I am Dr. Shripad Pujari, Head of the Department of Neurology at Noble Hospital, Pune. There is a lot of information available on internet on epilepsy. However, there are lots of myths as well as misinformation as well. So, we are here today to answer the 6 most Googled questions in relation to epilepsy and its diagnosis and treatment. The most important part is management really. The diagnosis is the initial portion which actually is looked after by the doctors. There are 2 types of cure in medicine. One, say for example, anybody has a corona infection, he receives antibiotics, antivirals for 15 days, medicines stop. And then there is another kind of cure. This is the state where patients have to take medicines. And then their tests such as brain scans and EEGs are repeated and the disease has gone away. Then slowly the anti-seizure, that is the anti-fit medicines, can be tapered down and stopped. In a small minority, however, the medicines may need to be continued for longer duration or for the whole of the life. Now, first and foremost, that the patient has had a fit before does not mean that the fit is going to go on recurring again and again in every individual. Majority are what we call provoked, which means say high degree fever, a sudden binge of alcohol, some head injury and other factors which have provoked a seizure. And then there are other external environmental issues that affect the brain. They are called triggers. After the first seizure, we as clinicians, neurologists, through history as well as our tests such as brain scan and EEG, find out how severe there is chance for that patient to have a recurring seizure. If there is a high chance, then we put the patient on medicine, and these patients, if they are free of seizures for say more than 6 months or a year, then they can drive and they can play sports provided they are clinically stable and the EEG is normal. It's useless to ask the patient to smell an onion, smell chappal, put keys in hands or try and restrain the patient. It is not going to get aborted by these maneuvers. If the patient is in an unsafe area such as on a high cot, then bring him down to the floor so that while jerking he will not fall and injure himself in addition to the jerks themselves. Second, put him to one side, remove anything from the mouth to prevent choking from that object and keep him in a comfortable position. Don't give him anything orally and let the seizure pass. Now, death from epilepsy, where I mean throwing up a seizure itself, is very rare. Only if the patient goes into a state where patient goes on throwing seizures after seizures continuously for more than minutes, say 3 to more than 10 minutes, it is then called as status epilepticus. It is this area where there is around 10%, that means 10 out of 100 patients can die. Even then, if the patients are shifted immediately to an emergency of an hospital and then from emergency to the ICU and intravenous medicines are given to abort the status epilepticus, then the chance of death is minimized significantly. We are working so hard so that patients with epilepsy live a normal life. We expect them to live a normal life. We have answered the 6 commonest questions asked about epilepsy. If you have any further doubts or if you wish to seek medical care in relation to epilepsy, we at Noble Hospitals have a multidisciplinary team who is all the time willing to attend you and offer you medical as well as social help. Thank you.